Imagine two hospitals of identical sizes, located right across town from each other in the exact same city. Hospital B is staffed by brilliant, life-saving physicians, but they have zero online reviews. They've never spent $1 on community outreach, and their physical entrance is badly neglected. Hospital A, meanwhile, employs perfectly average doctors, but they maintain an active social media presence, boast hundreds of 5-star reviews, and operate an immaculate, highly visible reception area. When a new patient needs care, they pick Hospital A every single time. Raw medical skill inside the building simply cannot win the initial patient visit. Take a look at this excerpt from a hospital marketing guide. It addresses a deeply ingrained assumption among medical professionals. If our doctors are good, patients will come. Operating a business on that idea is incredibly risky. An elite surgeon can execute flawless procedures and save countless lives. But those outcomes are strictly limited to the people who make it onto their operating table. This creates what we can call the perception gap. It's the massive empty space between how good your clinical team actually is and what the surrounding community knows about them. Relying entirely on excellent care to speak for itself is a silent trap that slowly starves a facility of foot traffic. We can see exactly how this plays out by looking at a real 50-bed facility in Kozhikode, Kerala. This hospital employed a highly skilled orthopedic surgeon who specialized in complex joint replacements, yet their outpatient department was consistently empty. This chart compares them to a direct competitor just 3 kilometers down the road. The competitor surgeon had far less experience, as you see on the left, but on the right, they were processing 4 times the daily patient volume. The local residents didn't evaluate both surgeons and choose the less experienced one. They simply had no idea the highly skilled surgeon even existed. The bottleneck wasn't a lack of quality, it was a total lack of visibility. The competitor won that volume through deliberate outreach mechanics. They were hosting community health camps, sharing patient success stories in local WhatsApp groups, and having their surgeon record short videos explaining knee pain. Meanwhile, the failing hospital sat quietly. They waited for passive word of mouth, allocated absolutely zero budget for outreach, and treated their website as a dead asset. Returning to our source document, we can see exactly how to reframe this for skeptical medical teams. It clearly states, marketing is not about lying or exaggerating. Marketing is about making your hospital's value visible, understandable, and trustworthy to the community you serve. In practice, marketing is simply the operationalization of community trust. It is the process of translating your doctor's internal medical expertise into external community confidence. Today, a patient's journey starts long before they physically walk through a set of sliding glass doors and approach a wooden reception desk. The initial search happens on a screen. For local healthcare, your Google business profile acts as your actual, functional outpatient department counter. If a prospective patient searches for care nearby and encounters a profile with missing photos, 0 reviews, and outdated hours, you forfeit that patient to a competitor instantly. Leaving that digital touchpoint unmanaged is the functional equivalent of locking your hospital's front doors during business hours. Fixing this requires immediate action. Claim your digital profiles, audit your current review counts, and allocate a starter monthly budget, even a small one, to get the engine running. Crucially, you have to create accountability. Assign one specific person on your team as the designated marketing focal point before the week is out. None of this replaces the medicine. Clinical excellence remains the heavy, immovable foundation of any healthcare facility, but outreach provides the critical infrastructure. It builds the necessary bridge to connect that medical foundation directly to the people standing on the outside. Skills are what save patients, but marketing is what brings them into the room to be saved.